So we have a webinar coming up in November. Can you give us more detail about it?
Sure. I'll be speaking about new payment systems and what physicians need to do in order to adapt and succeed under this new regime. We've all heard a lot about ACOs. A lot of folks think that ACOs really won't take off, but the basic principles that are included in the ACO idea are going to be included in future forms of payment for physicians, for hospitals, and other providers. So folks need to understand now what these systems are, what these tools are going to be, so that you can succeed in the future. Even if you're not going to sign up as part of an ACO, you may want to be part of a bundled payment initiative that CMS is rolling out right now. And in order to succeed in the future with commercial payers as well, these are the kinds of principles that you need to build into your practice. It's all about looking at episodic care, looking at case payments, case rate payments, bundled payments. In order to do that, it requires a real shift in thinking away from looking at hospitals as the enemy and towards looking at hospitals as your collaborators. You know, every physician who I've spoken to as a hospital-based practice thinks that they know better how to manage the costs in a hospital. And that's why many surgeons, for example, have established outpatient surgery centers. They say, well, I can manage an OR better than the hospital can. Well, in the future, you need to help the hospital manage because you'll be given a single payment for a case, and you will need to help the hospital reduce their expenses, and you in turn will be able to share in the savings. That's the future of healthcare, and the time to get on board with that is now.